Hello class and welcome to another exciting facilitation for this semester. I am Dr. Annie George, Department of Public Health, Faculty of Health Sciences, and will be your guide. Hope we all enjoy it. Thank you. On today's class, we'll be looking at topic 3, signs and symptoms of non-communicable diseases. At the end of the lesson, you should know what symptoms and signs are and differentiate between the two, and also understand the symptoms of common non-communicable diseases that we know. So what are symptoms? Symptoms are usually what we call subjective indicators in people. Subjective indicators that are coming from the patient, which expresses how they feel. Such indicators express how they feel. That is what we call symptoms. The patient tells you how they feel, coming from within the patient. That is what we call symptoms. So what are signs? Signs are usually objective and is elicited by health professionals. They are the ones that find out what signs are, and they do that through clinical examination, like when a doctor inspects a patient, touches a patient, and then listens with his stethoscope. You take measurement of blood pressure, take temperature, whatever the findings are all called signs. So signs are usually objective and they are found out by medical professionals from examining a patient. Now, in the next slide, we will be having activity. And the purpose of this lecture, like I said, is to dwell into signs and symptoms, know the difference. We will, dwell more into symptoms because you are not being trained to become a clinician. But as a public health person, you should be able to elicit symptoms, know what symptoms are, because they are all indicators of health conditions, diseases, and what have you, especially in non-communicable diseases that we're talking about now. If you're able to elicit indicators like symptoms of those non-communicable diseases as a public health professional, is part of your duty in learning the applied epidemiology of non-communicable diseases. So in the next slide, we will look at activity 1. So activity 1 says, what are the symptoms of high blood pressure? Take a look at the image briefly and then we'll continue. So hypertension, high blood pressure. What are the symptoms of high blood pressure? Interestingly, high blood pressure is a medical condition that comes without, most times without symptoms. It doesn't show symptoms in people who have it. is only elicited through sign by checking blood pressure. However, you could have people with some symptoms waking up in the morning with headaches, not sleeping properly, easily tired, and then heaviness at the back of their head, and then sometimes tears come out of their eyes. That is what we call symptoms of high blood pressure or hypertension for those who actually have it. Then chronic respiratory diseases. What we call chronic respiratory diseases are conditions like asthma, chronic bronchitis, emphysema. Usually people who have them will have cough, they get easily tired at little exercise, and oftentimes they wheeze. In the next slide, we'll have another activity. I want you to take a look at the slide, and then while we continue. So activity 2, what are the symptoms of diabetes? If you look at that image, you will see something that looks like a membrane structure, the layers of the membrane, showing receptors and movement of some molecules from one end to the other. The essence of that picture is to show you how insulin acts on the receptors in the movement of sugar or glucose from outside the cell to inside the cell. When people eat and the food substances are digested and you have sugar, insulin helps to act on the receptors to move in sugar from outside to inside. That's what that membrane structure is showing. Now, in the activity, we asked what are the symptoms of diabetes mellitus. Usually, there may or may not be family history of diabetes in such people. There could be excessive intake of water, and the person gets thirsty in as much as he takes water. The person also urinates excessively and takes food excessively, and despite eating excessively, there is progressive weight loss as well. So, and what are the symptoms of heart diseases? In heart diseases, you could have shortness of breath, you could have cough, there might be leg and abdominal swelling depending on the stage. You could get easily tired at little exertions, and sometimes there are poor sleeps at night. What are the symptoms of cancers? So we are talking about all these symptoms of these particular conditions, non-communicable diseases, because they are the commonest of the non-communicable diseases like we've been discussing so far. That's why I decided to focus more on the symptoms of those diseases I've talked about. So now we'll talk about cancer. Usually cancers have non-specific symptoms. It depends on the location of the cancer actually, and there are usually progressive weight loss in people who have cancer. They could have pressure symptoms depending on the part of the body that is affected. Sometimes there could be also family history of cancer. There are cancers that we know that are in the family circle of cancers. In such cancers like breast cancer, there could be family history of such cancers, or may not be family history anyway. So in summary, we learned that what symptoms are and what signs are, and how both are different from each other. We've also seen the symptoms of common non-communicable diseases that we have always highlighted. So in the next lecture, we will talk about prevention and control of non-communicable diseases. Thank you for listening.